Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we are in the middle of April. It is Healthcare Decisions Month, and one of the things that is related to that is caregiver fatigue. And so today we're going to be doing a different kind of talk. I'm really excited. It looks fabulous with Kyleigh Roessner. Kyleigh is an RN. She is a clinical nurse lead over at our TMC Hospice, and I'm sure she will share more about that as well. So, Kylie's going to be talking about caregiver fatigue and strategies for resilience. I know we have folks that are watching us online today, and we also have an in person audience. So, if you have any questions, our online audience, please leave them in the chat, and I will ask Kyleigh those questions afterwards. And I just want to welcome you here, Kyleigh. It's so great to have you.
Thank you. Thank you, Maya. Thanks so much for having me here.
Good. So I'll go ahead and put your PowerPoint up for you so that you can go ahead and get started, and then I'll join you back at the end for any questions.
Okay, perfect. All right, let's go ahead and get started. I just want to start with a little bit about me. So I've been with TMC Hospice for 6 years now. I started over at Peppy's house, and then I've moved over to their outpatient home care side. A lot of people don't know that we actually see patients at home, but we actually have a very robust home care component, and so that's where I've met a lot of caregivers, a lot of people trying to provide care for their loved ones in their home. So I'm currently the hospice nurse lead. I'm in charge of all those nurses, home health aides, all those people who provide care to you in the home. I'm also a mom of 3. I don't know if any of you recognize this picture, but this is the labyrinth outside of Peppy's house. So let's get right into it. So who is a caregiver? Really, anybody can be a caregiver. It's not necessarily a family member. It could be a friend, it could be a neighbor. In our hospice, we've seen very wonderful friend and neighbor caregivers. We even have pastors and boarding house owners be like our primary point of contact for our patients. So any person who provides any kind of assistance to an older person or an older adult. They can live with the person or not necessarily live with the person. A lot of people have moved out of state and their loved ones are kind of providing care telephonically. They're trying to contact us over the phone. They're sending support. So a lot of that also counts as caregiving. So just to differentiate that from a formal caregiver, someone who is paid, they provide those services for a fee. Informal caregivers, unfortunately, they do it, or fortunately, they do it out of the goodness of their hearts. Okay. Just a little bit of detail on how many people are actually providing caregiving services to their loved ones. 22.3% of adults reported providing care assistance to a friend or family member in the past 30 days. So that's a lot. Let's see, how many people do we have here right now? We have 8. I'm not good at math, but probably a little more than half right there, a little less than half. 10% of caregivers reported providing care assistance to friends or family members with dementia or other cognitive impairment disorder as well. So that's a significant amount of people. And let's talk a little bit about how much time those people are putting in. Of those people who are caregiving, a third of them, 1 in 3, provided 20 or more hours per week. That's equivalent to a part-time job that they're putting in. And over half of them have been doing it for at least 2 years or more. So that's pretty significant chunk of time dedicating their life to one person. So in Arizona alone, the combined unpaid caregiving would amount to $14.5 billion. If we were to pay for it, that's how much it would cost. And we can understand that this is pretty demanding. It's not just time demands, but there's also physical and emotional components involved with giving care to another person. Is anyone here a caregiver? Okay, so can we have a little bit of a discussion of the physical demands of caregiving? Does anyone like to participate with me? Go ahead.
Well, I live with my mother,
Mm-hmm.
and she has COPD, and she's now 82 years old, and it's gotten significantly worse. So I pretty much have to do all of the house cleaning as well and upkeep. So that's part of it.
Absolutely.
Part of it. She still can bathe herself and do things like that, but as far as cleaning out the fridge, doing the yard work, that all falls upon me.
That's all on you. A lot of the physical task of taking care of the home, all the cleaning, all the cooking, the laundry, all of that is on you. So not just for you, but also for her.
Yes.
Anyone else? Any other physical demands of caregiving you'd like to share? Yes, no? Okay. A lot of times, like for example, someone's unable to tie their own shoes. Like that's bending and twisting and helping someone put their shoes on. If someone is bedbound or needs help transferring from their bed to a wheelchair, that's a physical job. There's a lot of lifting and twisting involved. If anyone has incontinence needs or whatever, they're laying in a bed, there's turning involved. It can be very physically demanding. And also the hours, right? You might be staying up later than you would like. You might be waking up earlier than you would like to help meet these needs. So there's also emotional components to giving care. You know, a lot of these, you're grieving. This person has changed and you're sad about it, right? There's a lot of uncertainty in how their condition is going to affect you and how it's going to affect them. There might be a little bit of resentment because this is not necessarily something that you've chosen, and this is not a life that you would have chosen. So you feel a lot of feelings based on that. So over half of caregivers indicate that a decline in their health compromises their ability to provide care. So due to those demands, they've experienced a decline in their own health, and it makes it harder for them to do this unpaid job. 36.7% of caregivers reported getting insufficient sleep. So all of this kind of takes a toll. So this is just a little map from the CDC that indicates the percentage of people who reported frequent mental distress, unhealthy days, and insufficient sleep. And so I see Arizona right here, a very dark blue color, kind of one of the worst in the nation, 17.4% for caregiver burden, basically. So the CDC doesn't necessarily provide any theories or explanations of why it's so bad in some places versus others, but I do have a couple of theories. One of it is a retirement destination. You know, how many of you retired to Arizona? You left your place and you came here. A few of you. Okay, it might be, we get quite a few in our business. So a lot of these people, they're like, I'm leaving Minnesota. I'm tired of cold winters. I want to live in the sunshine. They come here. And it separates them a little bit from their family members, from the friends that they have built, from the community they had built. And so sometimes that they're a little bit more isolated if they haven't had the chance to rebuild the community here in Arizona, in this local community. Also, there's limited resources to support caregivers. I mean, every resource is limited in a certain way of thinking, and definitely resources to support the older population. So Meals on Wheels, respite care in the community, long-term care insurance, all these things are kind of limited just based on the number of people that are here. So my recommendation is to always, if you think you might need it, to get on a list and apply for it. I was speaking with a case manager who had just moved here from Massachusetts. So in Massachusetts, when you apply for Medicaid, you get everything that Medicaid has to offer. So that includes their long-term care, that includes a caregiver assistance program. It's not necessarily like that here in Arizona. If you have Medicaid, because you're on a limited income, you don't have their, as we call it, Altex, their long-term care benefit. You have to apply for that. That takes several months. And let me tell you something. People don't like to ask for help. Does anybody here like to ask for help? No.
I'm willing to.
You're willing to. Good, good. It's a good skill to learn. We find sometimes that caregivers, they tell themselves, I can do this. I can do it. I don't need help. I can do it. And then they wait till they're at their breaking point to ask for additional assistance to bring in those additional resources. And it's terrible to tell them the help is coming, but it's 2 months away. It's 3 months away, or I can't give you a timeline. So it's just one of those things to keep in mind when you're providing care for your loved ones. If there's things in the community you think you might benefit from in the future, get the information, get on the list as soon as possible. Okay, so let's talk about resilience. What is resilience? Personal resilience is the ability to maintain well-being and effective functioning in the face of high levels of disruption. It involves adapting well in the face of adversity, trauma, threats, and stress. It means bouncing back from difficulties with your family, relationships, health, workplace, home life, finances, etc. And I found it interesting because caregiving affects every aspect of those things. Your family relationships, your financial lifestyle, your health, your workplace, if you're still working, and a lot of people are still trying to work while they're caregiving. So resilience doesn't change the circumstances that you're in. It's how you adjust to those circumstances. So as much as, we would like to wave a magic wand and make things better, what we can do is work on ourselves and how we change our interaction to these things. So that's why I picked this picture of a boat in a storm. When you're in that boat and you're in that storm, you can't change the storm. You can only change how you navigate it. So resilience is a muscle. Just like that skilled sailor, as you practice the different skills and abilities, you can become more resilient in your daily life. Okay, I have 5 strategies, 5 different things you can do to build your resilience, 5 different muscles you can work out. The first one is positivity. I got Pollyanna on there for us, right? She's always looking on the bright side. So, but it goes beyond looking on the bright side or saying it could be worse. It is an intentional reframing of your thoughts to be oriented towards growth, gratitude, and acceptance. So I have some examples. This is a disaster. A lot of times I've heard this. This is a disaster. I am in this situation. Everything is coming down around me. So a simple reframe. I'm doing my best in my difficult situation. It's not perfect, but I'm doing my best with what I can do. No one is helping me. I am so alone. There are a lot of people who care about me, but right now this is something I'm working on by myself. Oh my goodness, I just turned off the whole thing. Sorry about that. I can't do this. I can't do this. I just turned the whole thing off. I can do one thing at a time. I'm doing my best, and my best is enough. So you're taking yourself from making commentary on the entire situation and your feelings about it and putting yourself back in the driver's seat. You are a person. You have abilities to make change. And it's giving you like a leg to stand on. I can do what I can do, and I am doing it. And I'm doing a good job, even though the situation is negative around you. And this is really the crux of resiliency, is recontextualizing the world that you're in and putting yourself in a place in it where you're in control. You're in control of yourself, and you're in control of the things that you can be in control of. So even problems can be reframed. I found an example where someone was saying, I don't sleep enough. I'm not getting enough sleep, I'm exhausted. And reframing it to, I need to improve the quality of my sleep. I'm gonna go to bed at 9 instead of 10. So finding solutions-based rather than problem-based. I have some more positivity practice ideas. Taking the time to write down those good moments, those moments that you have with your person that are positive, where you have good reflections, where they express gratitude, and reflecting on those moments when you're feeling low. Sometimes I have to do that in my marriage, right? You gotta write it down, the times that were, okay, this was when we were really doing good. Reflect on them when things are not so good. Photography can also work in a similar way. If you feel like, I don't have the time to write, taking a picture and reviewing those pictures on your phone. Celebrating the really small wins, congratulating yourself for the small things. You took the trash out, pat yourself on the back. A lot of those things, they're very small, but they're the little bit of positivity you need to get you through your day. Laughing, making jokes, listening to funny things, comedy podcasts, reading funny books, all of those things can contribute to your overall well-being. And listening to music that you like while you're in the car driving around, getting hyped, that kind of thing. Number 2, adjusting your expectations. It says adjusting, but it should just say lowering. It should just say lowering your expectations. There's a lot of societal things that are put on caregivers. Like if I say the word caregiver, there's certain other terms, descriptive words that come to mind. So does anybody, when I say caregiver, what do you think? What is a caregiver like? Are they giving? They're compassionate? Selfless, exactly. So when you're putting yourself in that role, you're a saint, you're a rock, oh, you're an angel, oh, you're just doing everything. Has anybody heard that, saying, oh, you're an angel for doing this? How did it make you feel? Did you feel like an angel? No. So when the expectations are that you are a celestial being, we need to drop it down a little bit. You're a person and you're doing your best. So not only do other people put that on us, we put it on ourselves, right? Like, oh, they say I'm an angel, I have to live up to these expectations. But really, you know how you really feel. But this is hard and I am struggling. So we're getting rid of that. We're not this. This is not the thing. You're not lightly dabbing a washcloth on someone's head. You are not a special angel. I'm sorry, bad news. And caregivers are like angels without wings, helping us out with so many things. No, we're putting that away. You are a regular person. You are doing your best. And I do want to acknowledge that a lot of time when people say these things, they're doing it with the best of intentions. They want to acknowledge your hard work. But we just don't really have the words for that in our society to say, you're doing the job, even though you might be struggling. I just want to acknowledge you. It's just easier to say you're an angel, but you are not. So a lot of these things come with these expectations that you're never going to make a mistake, that somehow through your vigilance, you can control the disease process, that someone is going to get better based on what you do or don't do, or that you can do it without help. So I have an example. I had a friend who was taking care of their mom and let her sister take her mom to the store. And when they were at the store, mom fell. So this is kind of a way that, this is a little bit of there's two ways she could have dealt with this. Double down, goes, you can't take mom to the store anymore because you're not doing it right. Or let me help you practice how you can take care of mom. Let me go with you next time and we can make sure mom is safe. So you can kind of see how one way contributes to isolation. It contributes to burnout because you're not using your resources. You have those high expectations on yourself. Nothing ever bad is going to happen because I can control it all. Versus being more collaborative with the resources that she had available. And things are not going to go perfectly every time. And realizing that and acknowledging that is a really big step towards, becoming more resilient. I can't control anything. I can only do my best. A lot of times with our hospice patients, we'll have people really fixating on getting their person to eat. Because if only they can eat, they'll have more energy and they'll have more strength and they'll keep going. And that's just simply not the case. A lot of times they don't want to eat. They just want to rest. They're too tired. Their body can't use that food. And so the fixation becomes very, unnerving for the caregiver. And it's a big loss to them. So letting that control go, this person's going to do what they're going to do, and I'm going to do what I can do to support them, but I'm not going to be able to control everything. Okay. Managing your feelings. So acknowledging and embracing the idea that you're going to have some negative feelings. You're not necessarily going to be the angel that always embraces and is always happy to do all of these things. It's okay to be tired. It's okay to be disappointed. It's okay to be resentful and frustrated and lonely. And for some people who have those feelings, they feel guilty about them. And it just kind of is a self-reinforcing negativity cycle. Oh, I'm so mad, and then I felt guilty, and then I'm mad again. So we're going to embrace those feelings. We're not going to fight these feelings. Thank you, REO Speedwagon. we're going to share them with other people who feel the same way. A therapist, a support group, a friend, and validating that those feelings are normal, that they are acceptable. When you embrace them and accept them, they can move along. I've heard a metaphor of like these negative feelings being like a storm. You let them roll in and you let them roll out. But when you fight them, they kind of tend to double down. I just wanted to showcase some of the support groups. These are all through TMC for Seniors. These are the support groups that are available through them. There's Alzheimer's Association, Parkinson's support groups, stroke support groups, a women's group, all very wonderful resources and opportunities. Here's another one for the Pima Council of Aging. These are just support groups for the first 3 weeks of April. Some of them are even on Zoom. So there's a lot of availability to find that support in the community and help express and validate those feelings that you're having for caregiving. Okay, empathy.
She has a question.
Oh, sorry.
I'm sorry. On that last page, emotional aspects, managing your feelings. And then you said just know that they're normal when you can embrace them and what was the last part?
And then let them go. You have them, you embrace them, know that they're normal, don't feel any guilt about having those feelings, and let them go.
And then you compared it to a storm.
Like a storm. Like a storm rolls in and then it rolls out.
Thank you.
No, sorry.
Yes.
Do you have a handout of that last slide?
I don't.
That
But
was-
it is on the internet. It's a screenshot directly from the internet.
Okay, it's Pima County.
Pima Council on Aging. I don't know if we can add that to the chat for Facebook. Okay, wonderful. So, empathy for the person we're caring for. A lot of these people who become dependent on us did not want to become dependent on us. That is not their dream. That was not their goal. It just kind of happened. They probably feel ashamed or embarrassed that they need your help. They are dealing with their declining health and their potential mortality. So that's a lot for them to bear. A lot of them are grappling with the loss of sense of self. Think of the things that define you as a person, the jobs that you have done, the roles you have played in other people's lives, the volunteer work you've done. That's who you are as a person. And when you can't do that anymore and you become a dependent, they don't know even, then who am I? Then what do I do? In addition to physical symptoms, they could be having pain, they could be having confusion, nausea, other discomfort, forgetfulness. They have all that to deal with too. And as a result of that, they might not be a generous recipient of your care. They might not want you to take care of them because, I'm sorry to use you, your mom used to take care of you.
Yes.
And so that role reversal is difficult for people to grapple with. Just like we're humanizing our caregivers, we need to humanize the people that we're caring for. So here's another picture of people generously receiving care, and we're not doing that. Next. I did want to share an example of my own grandmother. It'll be a year ago that she's passed now. She needed hearing aids. She would sit in the back of her little church group and she couldn't hear a thing. So my mom decided to buy her some hearing aids from Amazon because the lady would never go to get her hearing tested, right? Because that's what old people do. Old people need hearing aids. She was 96, okay? So, but she's not an old person. She doesn't want people to know she's wearing hearing aids. So my mom has some hearing aids from Amazon delivered to her house. And she gets a notification on her phone, it's been delivered. She goes, Mom, these are supposed to be delivered. Where are they? She's like, I don't know. Packages, right? And she's like, it said it's delivered. And my grandma had taken it and hidden it under the couch cushions because she didn't even want to approach the idea that she might need hearing aid assistance. So even though my mom's trying her best to give her, plug her back into her community that she cares about, not interested in that. So that's the kind of the resistance that we can expect. All right, so one thing you can do is allow them to be as independent as possible for as long as possible. There's gonna be things they can do that are not perfect. They're not gonna button the buttons exactly right on their shirt. They're not gonna be able to make the meals that you think they should be eating, right? But if they can put one of those little things in the microwave and hit the microwave, that's good enough, because it's at least some of their independence. Sometimes we have the tendency to say, Mom, no, stay in bed, sit down. Or no, like, don't get up. Let me get up and get it for you, because I don't want you to fall. A lot of times with mobility, it's kind of use it or lose it. So encouraging them to use those mobility aids, supporting them as much as possible, it's so hard. But what it does is it does reduce your future caregiving burdens, because if they can't get up at all, then you're dealing with a complete total care situation. So just keep in mind, put yourself in their place. What if the tables were turned and you were the dependent person who needed help? And honestly, that's a lot of us in the future. We're going to eventually need support from other people. And how are we going to deal with that situation? And another idea is to have a strategy for when they do have their bad days. Sometimes they might act out. They might say, leave me alone. I don't need help. I don't want you to help me. So decide how you're going to do it. Are you going to say, okay, Mom, I'm going to check in with you tomorrow? Or are you going to say, why don't we take a drive? Let's go get some ice cream. And that might take some tweaking, but eventually I think you'll find your way. Don't take it personally. It's not about you, and it's not about how you're providing care. It's how that person is grappling with a change in their role and a change in their sense of self. And knowing when it's time to ask for help to support them, knowing when to step out of the game, when to find respite care. Does everybody know what respite care is? Respite care is, there's different places in the community that will take care of your loved one for a short period of time. So a few days here and there, if you've got to go to a wedding, or if you just need a break, there's different places where you can find a place for them to be safely and well taken care of while you take time for yourself. Or when to reduce your caregiving responsibilities by outsourcing to other people. It's important to remember that you deserve respect and dignity, that your needs need to be met. You need to go to the doctor. You need to be able to sleep adequately. You need to eat right. You need to have other meaningful relationships outside of caregiving. The goal is to respect their humanity and choices while retaining your own sense of self. And finding that balance is kind of the tricky part, right? And over time, it may evolve, especially as their care needs evolve. Setting boundaries. So first of all, if you're finding that you're in a caregiving relationship where you're doing more time, then you're losing your sense of self, you're kind of feeling those burnout feelings, decide what is going to be the thing that's going to help you regain that sense of self and balance. So this is, find where you would like to draw a boundary or create a boundary. Going for a daily walk, going to bed at a certain time, letting go of certain responsibilities, taking certain time for yourself, and making sure that you have adequate nutrition for you. So you've decided, you've picked a boundary, okay? So the first step is to communicate that boundary or that need clearly, okay? Not, it'd be nice if I could get out of here every once in a while. Not that. That's not what we're doing. Here's an example. I have a few examples. These are in the additional handout if you're following along. So you need to eat 3 meals a day so you feel good. This is how a good script for it to say, I need 20 minutes 3 times a day to cook and eat in silence. I love to chat with you, but I can't give you my all without some quiet meal times. A very reasonable request. Get thoughts out on a journal before bed to improve your sleep. Hey, can we take care of everything you need by 9 o'clock so I have an hour to journal and wind down? How about we start your meds at 8 instead of at 8:30? There's a couple more. So you want to exercise 2 to 3 times a week. I'm going to be going on a morning walk after your morning routine on days that I feel up to it. I want to let you know that's on my schedule, and you're welcome to join me whenever you'd like. Sleeping 8 hours. I'm a night owl and you're an early bird. That's hard for me, but I think we can find a solution that works for both of us. How can we set you up for the unattended time between when you wake up and when I wake up? And then helping create that plan with them. Engage in activities that bring you excitement. My soul needs some recharging, and I think a long hike would do the trick. Is there a window of a couple hours in the next 2 days when you won't need my help? So you're saying, you're very clearly communicating your need, you're telling them what that need is, and you're helping find a way for them to work with it. We have a duplicate. So, enforcing your boundaries. The first one is no is a complete sentence. So this is specifically for when other people try and ask you to take on more responsibilities. They're like, oh, they're always home. They can do this and this and this for me. No, I can't do that, thanks. Restating the boundary, leaving the room and potentially leaving the situation. Because we decided those boundaries are what you need to maintain the caregiving relationship, right? It's kind of scary. It's kind of scary to put that boundary and put those demands on the relationship. But ultimately, those are the things that preserve the caregiving relationship. I got ahead of myself. See, I know how to do this. Knowing when to take a break, knowing when to take a walk around the block, when to hire help, when to seek respite care, and when to look for placement in a care facility. These are all normal and healthy choices for you and your loved one. Like I said before, there's times when people, they resist asking for help until the very last minute, until they are absolutely fried. It's a 5-alarm fire. And there's times when being the family caregiver is no longer a good option for either you or the person you're caring for. So we've had multiple experiences where someone is taking care of someone else and that relationship completely breaks down. And we've had to help facilitate other arrangements. And that's normal and it's totally acceptable. Like, know that you have done your best for as long as you can, and that it's time to relinquish those responsibilities. Okay, number 5, facilitating a connection with others. So if you're able to build strong communication with others and reach out to them when you need help. Building a community, finding a community either in person or online. Connecting to resources through different agencies, different caregiver advocacy groups like the Alzheimer's Association or the ALS Association, hospice services. These are all different ways for you to build that connection with other people, have conversations with other people that don't necessarily involve the person that you're caring for. And just, it's incredible how much power there is in understanding that you're not alone and understanding that the situation that you're in is not unique. And that's what some of these are for. Asking for help. This is a strategy for asking for help. No one here said they ever asked for help. Maybe you did. You said you'd be into it one time. But it's difficult, especially when your person may have complex care needs. So, well, step-by-step, we're asking for help. Number 1, make a list of everything that you're doing. Number 2, identify what you're willing to get help with. Think about who in your community that you have built would be willing to help you. And when you make the request, offer some options. Could you do X or could you do Y? Thank them, then move on to the next person and don't take it personally. So here's a little comic. This person is saying, no, I'm fine. And this person saying, I can help, let me know. I'm sure a lot of the caregivers have heard people say, I'm willing to help, I want to help, just let me know. In this little person's mind, if I accept help, that means I am weak and I'm needy, plus I would feel like a burden and I would feel guilty. But when underlying assumptions about accepting help are not true, they can disrupt the healthy balance in giving and receiving. So it helps to think, if I was in this person's shoes, would I feel inconvenienced or would I feel guilty to help do this for another person? So I have an example. So let's say you need help getting groceries. It's too difficult to take your person to the store anymore. They need a lot of assistance, so you're not really able to get to the store anymore. So you've identified that need. Who is a person that would be able to either go to the store for you with a list, or who would be able to sit with your person while you go to the store? Find that person and give them those options. Hey, I'm having a really hard time with Francis. They are not able to get to the grocery store. Is there a way you can pick up some things for me, or will you sit with him or her while I go? You can also think about community resources. There are different places in the community that will deliver food for delivery, or they have food box you can drive through and pick them up. And there is even some technological solutions, like you could potentially order your groceries online for delivery. And if you don't know how to do that, you could identify someone in your circle who can teach you and show you how to do that, or who might be willing to do that for you. So these are all different ways you could approach getting this certain need met. Let's say you need to go to the doctor, and you should go to the doctor. It's one of the things that caregivers don't do, is they don't get to the doctor enough. But that person isn't really able to sit in the waiting room with you. Maybe you don't want to discuss your health problems with them present. Find a person that you trust. Ask them, would you be willing to accompany me to the appointment and just drive around the block with them while I'm in there? Or would you be willing to sit with them while I go to my appointment? So I do want to talk a little bit about hospice and how hospice can help support caregivers. So hospice is specifically designed not just for the patient, but for the entire family and their entire support network. So the emotional and spiritual support are baked in. Every single patient gets an assigned social worker who can help with those psychosocial needs, and a chaplain if they would like one. So we can provide caregiving equipment, medications, a 24/7 nursing support, always assistance with bathing, incontinence supplies, and we also provide respite care. Hospice services are always free under the Medicare benefit, and a conversation with a hospice representative is also always free. We're happy to always chat about hospice and how it can help people. So when you are on hospice, all of the care comes to you. So all of the equipment, like a wheelchair or a hospital bed or an oxygen concentrator, is all delivered to your house. The nurse comes to you. The home health aide comes to you wherever you are. We even have the medications couriered. It's all delivered to your house. So when those things become difficult, it's difficult to take your person away from the house. You don't have to worry about that. You just stay in your home. Also, we do go into other facilities. Wherever that person's home is where hospice can go. So we've had some unusual situations where someone received hospice care in a church, in a boarding house, long-term care facilities. It's really tailored to the needs of that patient. However, the biggest limitation of hospice is it's not all the time supportive care. So a lot of that burden, that responsibility, the person giving your loved one medications is still the primary caregiver. So hospice is there to provide you with support in knowing when is a good time to keep going with those medications, when is a good time to stop, and to provide advice and guidance as your person kind of moves through their disease process. Okay, so I just wanted to review. Just like anything rewarding, caregiving can be challenging. Developing a few strategies, like these 5 strategies we talked about, can help you provide caregiving for a loved one while keeping yourself sane. Here's our 5 strategies. Positivity, adjusting your expectations, empathy, setting boundaries, and creating connections. Okay, and that is it. I'm going to put on my phone. Thank you, Paige. And go ahead, Maya, questions.
Yeah, so thank you so much. I'm going to leave this up for just a moment so that people have the hospice number. And I actually have it that I'm going to run it on the screen as well. So that if people have questions about hospice, they can obviously contact TMC Hospice at 520-324-2438. So thank you for providing that. Kyleigh, this was great information. Now, a couple of things that I was thinking about, throughout your presentation. And I know, and we'll talk about the support groups in a minute too. So thank you for sharing all of that. One of the questions that came in was, when you have somebody that says, "Oh, you're a saint," or "You're an angel," as you were talking about, and when you get if that praise bothers you, how do you respond? And obviously, we know that it's coming. It's a heartfelt, response that somebody is giving. So they don't. Their intention is not bad, but how should you respond to that if somebody was to give you that kind of praise?
That's a really good question. And I think a lot of that depends on probably your relationship with the person who said it to you, right? If it's someone you don't really know, you just, say, "Oh, thank you. I really try my best with him." If you want to use some humor, you can be like, "Yeah, I'm waiting for my halo in the mail," something like that, just to kind of show them that what they're saying is a little silly. But, you could say, "Well, actually, I really need some help. Do you think you could help me with so-and-so? I'm doing okay, but I really could use your help."
And I do think that we see folks have, as you mentioned, a real challenge with asking for help. And whether it's because they don't want to burden somebody else. And I know I'm oftentimes asked, what can I do for somebody in that situation? Sometimes it's just actually sort of doing something, such as, "I'm going to bring you a meal. What would you like? Let me drop a meal off. I know you may not want me to stay, but, I'd like to drop you a meal off," or something to that effect. Maybe really helpful, but that way they don't have to ask for it, but, you're able to help them. I don't know if you've used that technique before or not.
I love that. I also like the idea of kind of reversing what we said for asking for help and giving people options to offer help. Like, I have got 3 hours on Saturday. Do you want me to sit with your person while you go somewhere? Do you want me to fold laundry? Do you want me to, bring you a meal? Like, this is my time. I have it for you. How do you want me to spend it?
Right. Or walk the dog, right? I know oftentimes people have a pet and they, their poor dog has been sitting there and they can't get out to maybe walk the dog. So there are all sorts of things, but I know it's really hard and people have a hard time asking. So maybe thinking outside of the box. So I love that. I had a question just come in asking about the requirements for hospice care and can it be renewed? Can you maybe share a little bit more about when somebody would be appropriate for hospice?
I'm so glad you asked me this question. So hospice, the basic Medicare guideline is you have a terminal illness with a 6 months prognosis. Now, what does that look like? Does it have to be 6 months? No. And most of our patients, I would say, can easily be renewed for more time, as long as we can prove that they're showing some decline, some symptoms of decline. So at the 6 month mark, if you're not dead yet, you don't get kicked off of hospice, right? It's really an evaluation between the nurse and then the doctor, and really determining, okay, how is this person declined? Do they continue to eat less? Do they walk around less? Are they having more symptoms? When they still benefit from hospice care, then we keep them on. Another good question to ask is if hospice is right, does this person want to keep going to the hospital? Do they want to keep going to the doctor? Do they want to keep pursuing aggressive medical treatment? And if they don't, then it's a great time to at least consult with a hospice representative and see what situation that you're in, and they can answer specific questions based on what your needs are.
That's great. I did put up the phone number just a minute ago, but again, for TMC Hospice, the phone number is 324-2438, or you can also email hospiceinfo@tmcaz.com for more information on that. And it really, there are so many services that are wrapped into hospice that people are not aware of. But it's, when you're looking for that comfort care, that's always a way to go for sure.
It really was an incredible benefit. It's one of the best things that Medicare has done for our country. And it really does encompass so many things. It removes so many barriers. It provides so much support. A lot of our patients, say they wish they had gone on hospice earlier so they could really benefit from all of the things that we have to offer.
Yes, absolutely. And also, could you just also share a little bit about Pepe's House so that people know the options, when you are in hospice, there's, what happens at Pepe's House for hospice?
So, like I said, most of our care is actually at home. Our home hospice is 95% of our program because that's how it's designed, is to really provide care at home. Pepe's House is for symptom management. So when someone is at the end of life and they're having some distressing symptoms, they're having uncontrolled pain, they're having shortness of breath, they're having nausea, we can bring them into hospice at Pepe's House and provide that intensive symptom management to really get them comfortable. We have all of the benefit of being with TMC, all of their resources, all of that equipment, wonderful, excellent nurses to provide 24/7 care. And that's the primary purpose of it. But we also provide respite care there. So kind of what I was talking about, you take a few days for yourself to go on a trip, to go visit grandkids or whatever. We take good care of our hospice patients there as well. And actually our Pepe's House is we only provide respite to our hospice patients. So you do have the requirement of being a TMC hospice patient to stay there. And unfortunately, we don't provide long-term care there. Sometimes we get calls where people say, do you have rooms available at Pepe's House? We want to stay for 6 months. That's sadly not an option. We would love to keep all of you forever at Pepe's House, but we have 16 beds only, and they're just for our most ill or respite care patients.
It is a beautiful space that provides that temporary respite that somebody might need, and maybe some pain control as well. I know that oftentimes that happens there. So we do love Pepe's House. The last thing I just want to share about is, again, about the caregiver support groups that you mentioned with Pima Council on Aging. I am putting up the information for Pima Council on Aging. This is the facilitator that runs those specific caregiver support groups, and we do have copies that we'll be handing out in person as well. So anyone in the audience will get the list. The phone number is 520-305-3405, or you can visit pcoa.org for more information and just type in caregiver support group, and that information will pop up as well. Kyleigh, I want to thank you so much for being here today. This was amazing. You gave incredible information that I think everybody can really use at a time when they need some resilience, particularly for our caregivers. So thank you for being here. I'm going to close up with our online audience, and then you can answer any questions for our in-person audience. So thanks again.
Thank you so much, Maya. Thanks for having me.
Thanks again for being here today. We look forward to seeing you again as we continue on with our Healthcare Decisions Month. Tomorrow is Because Everybody Dies, Funeral Planning Rights and Options at Wednesday, April 17th at 2 p.m. If you're interested in this class, please give us a call in the office and we'd be happy to get you signed up. Phone number is 520-324-1960. And then we'll be back on Thursday for the gut-brain connection. And then next week, we also have Navigating Comfort Care from Palliative to Hospice. This will be a great talk with Dr. Shana Simmons, who is the medical director of our TMC Palliative Care Unit. So please, again, if you're interested in any of these classes, call us at 520-324-1960. 1960. Have a great day.